It's a great time to be in clinical work and research. We're at the forefront of a lot of things happening.
During our strategic planning process, what we identified were 4 areas, we call them research clusters, where we've had a long history of research excellence. These include bone and joint, neurosciences, brain, immunology, inflammation, infection, and prevention, health promotion, well-being. In addition, we identified 4 emerging areas. These include regenerative medicine, health equity, social determinants of health, cancer, and metabolism, cardiorenal.
The Alzheimer's disease in the brain occurs with a bunch of other diseases in the brain, and that brain is occurring in a body that's aging. And so we try and study all of that.
We have over 750 African Americans, and about half of them have agreed to give their brains when they die. There's no other study that is getting brains from older African Americans.
We've been able to identify specific nutrients and specific foods that seem to be particularly important for the brain.
We now have outlined this series of steps that we need to go through that results in a drug that can actually go into people.
In the area of joint replacement, we've been doing some of the basics to understand how materials interact with the human body and ways that we could use that information to potentially lead to longer and longer lasting joint replacements.
Our work identified a molecule in the blood called suPAR that we believe is the cause of many kidney diseases. We blocked the molecule so we could show that you can reverse the disease or stop it.
We can take a patient's T lymphocytes, which are the part of the immune system that seems to be critical for fighting cancer, out of patients, stimulate them, manipulate them, and then give them back to patients, and they now are able to fight cancer.
So I work on viruses that infect the brain, and the 2 viruses are HIV and Zika. We are focused on trying to understand how HIV gets into the brain and what kind of adverse effect it causes. And we're doing the same thing for Zika as well.
We can really make the biggest mark in the area of translational research. That is research that is translated from the laboratory into the bedside, and then from the bedside into the community.
Rush in particular recently had some success with securing a 5-year Clinical Translational Science Award, CTSA award.
It will open up a lot of opportunities for our patients and for our researchers to participate in research.
I do quite a bit for the Capricorn Project to utilize information collected in the electronic health record to better understand patterns of care. I've also been involved in working with the Precision Medicine, All of Us research program to try to recruit 11 million people to participate in a study looking at environment and genes and lifestyle choices and how that impacts health.
We actually have a very novel partnership with an entity right here in Chicago called Tempus. Tempus is a pioneering entity that is trying to understand the genomics of cancer and using the genomics and genetics of cancer to predict what treatment somebody should get with a minimum amount of side effects and problems. Because we're a single integrated system, we're probably better situated to transfer that knowledge to practice. Can we find the best of that and translate it to the benefit of patients? We can, and we will.